Thanks, Professor Donner, for this kind introduction, and good morning to everybody. I am particularly grateful to EHA for selecting this presentation for the press briefing and also for offering us the opportunity to present the efficacy of the approach not only in transfusion-dependent thalassemia, but also in patients with sickle cell disease, and these are my disclosures. The results that I am going to present derive from two phase 3 trials, the CLEAN-THAL 111 and the CLEAN sickle cell disease 121, enrolling respectively thalassemia or sickle cell disease. The key inclusion criteria are reported in the lower part of this slide, and you can see that the thalassemia population included patients with an age comprised between 12 and 35 years and with a transfusional burden of at least 100 milliliter per kg per year or 10 transfusion in the previous 2 years. And the sickle cell disease population included patients with at least 2 vaso-occlusive crises per year in the previous 2 years. The primary efficacy endpoint was the proportion of patients achieving and maintaining over time an unsupported hemoglobin level equal to or greater than 9 grams per deciliter without any transfusional support in the thalassemia population for at least 12 consecutive months, while in the sickle cell disease subset, we evaluated the proportion of patients without any severe vaso-occlusive crisis for at least, again, 12 months. And the upper part of the slide summarizes the patient journey, which started with the mobilization of the hematopoietic stem cells performed through the combination of G-CSF and plerixafor in the thalassemia population and plerixafor alone for the sickle cell disease patients. Exa-cel is a non-viral gene editing therapy based on the use of the CRISPR-Cas9 editing for disrupting BCL11A, which is the gene suppressing the production of the fetal hemoglobin after birth of each human being. And you can see in this slide the main message in terms of patients' outcome and efficacy. Indeed, in the primary efficacy set, which included 27 and 17 patients in the thalassemia and sickle cell disease population, and these are the patients with a follow-up of at least 16 months. You can appreciate that the proportion of patients achieving transfusion independence with the pre-specified hemoglobin value approach 90%, while the proportion of patients without any severe vaso-occlusive disease is 94%. Considering the key secondary endpoint estimated at 6 months for transfusion independence in the thalassemia population, you can observe that the success rate is comparable, and evaluating the proportion of participants without any inpatient hospital stay, you can appreciate that the success rate is 100%, and though these values are highly statistically significant as compared to the pre-specified hypothesis of an efficacy of 50%. This cartoon summarizes the hemoglobin level and the hemoglobin F in the thalassemia population, you can appreciate that starting from 6 months after the infusion of the edited cells, all the patients had at least an hemoglobin F of 9 grams per deciliter, with the exception of only 3 patients who didn't achieve a transfusion independence, but in these 3 patients there was a very marked reduction in the transfusional burden, and one of the 3 is now free of any transfusion in the last 3 months. And you can appreciate in the sickle cell disease population that the proportion of the hemoglobin level, F level, was above 40%, this preventing the occurrence of the vaso-occlusive crisis that I was alluding to. The exa-cel safety profile is consistent with a myeloablation based on the use of pharmacokinetic adjusted busulfan conditioning regimen and autologous transplantation. There was only 1 patient who died in the sickle cell disease population because of a COVID-19 pneumonia, which occurred some months after the infusion of the edited cells. And for the remaining part, you can see that the severe adverse event related to exa-cel was 0 in the sickle cell disease population, and 2 patients had some severe adverse event in the thalassemia population, which resolved after appropriate treatment. So overall, this data indicated that exa-cel can provide a one-time functional cure to patients with either thalassemia or sickle cell disease. And in this pre-specified interim analysis, the results that we have obtained are sustained over time. In particular, all the participants had early and sustained increase in the total hemoglobin and fetal hemoglobin with pancellular distribution of the edited alleles. And also, when we evaluated the percentage of edited alleles over time, we demonstrated a durable proportion of edited BCL11A allele, which didn't modify over time. And as I mentioned before, the safety profile is consistent with that of autologous transplantation preceded by myeloablation with pharmacokinetic adjusted busulfan. And this data clearly offers a new perspective for a functional cure in patients with hemoglobinopathies. Thank you.